Thanks so much for having me, and I'm really excited for Janine's campaign. Really looking forward to having her back in the state Senate. You might hear some kids playing in the backyard next to me. Hope that doesn't bother you too much. But I am an emergency medicine doctor. I won't speak for any of my institutions, but I will speak for myself as a private citizen, one who's very excited about this campaign. And the reason I'm excited is because, there's a lot of people who talk a big game about fighting for us, and there are people who actually are doing it. And Janine's one of those people who's actually doing it. And I've learned over the course of my life always to trust the people actually doing the work. I'll tell you a brief story just why that value is so important to me. When I was in college, when I was an undergrad, I had I spent every Saturday night working at homeless shelters near my school with other students, and we would, make the beds, serve meals, clean the bathrooms. I made a lot of friends there and found it to be really valuable. At the same time, I was getting recruited for something called a finals club. These are like frats for plutocrats, basically. And I wasn't a plutocrat, but like a lot of my friends, they wanted to get into these groups because they saw it as kind of like a stepping stone to the upper echelon. They would use it as, they said, like a platform to do good. But if you actually went to the clubs and saw what they were doing, they were these mansion houses where people drank pretty expensive alcohol and invited freshman girls to stare at all their expensive things. And pretty soon I came to realize that that wasn't for me at all. I was never going to be part of those clubs. I was always going to spend my time and my energy with people who are actually doing the work. When I got here to Rhode Island, same thing. Again, I started to do some research on the history of medical debt, and I spent some time in the Kent County Courthouse. And there, you can go in yourself. You don't have to be, you don't have to show anything at all. You just ask to go sit in the computers behind the clerk's desk, and they'll show you everyone who's ever been sued and by whom. And I realized pretty quickly that my own hospitals were the ones doing the suing, which is something I didn't know. No one told me that before. And so I had always promised my patients that if they couldn't pay, there'd be ways for them to get their bills paid. But that actually wasn't true. People were getting sued by my hospital. And I got so angry by this that I wrote an op-ed and I sent it to the Globe. They weren't interested. I sent it to the Journal. They weren't interested. I sent it to Steve Ahlquist, and he was interested. And, I didn't know if it would have the kind of effect I wanted. This is, Uprise Rhode Island is a great site, but I was like, who's reading this? Other than preaching to the choir. And I realized that night that a lot of people were reading it because I got a call from my boss saying, I think you might be in some trouble. So, I had a lot of meetings where I had to listen to how people who were my bosses were supposedly more progressive than I was. But they just thought I was being unkind to my friends, i.e. my bosses. And I was told I was being untruthful, and I was told all sorts of things. But, some people stuck up for me, and one of them was Janine. She posted it, and she got it some wider circulation, and pretty soon the hospitals declared that they would never sue patients again. So, I'm always grateful for people who are willing to stick their necks out and not just go along to get along. And, this is Rhode Island. Like we if you sit in enough state Senate hearings, and I actually sat in a few, I always hear the same question when someone proposes something big and bold like Medicare for all. It's always like, oh, has Massachusetts done this? Has Connecticut done this? I heard Vermont tried this. Maybe it didn't work. And no one ever says we're Rhode Island. We can do something big and bold ourselves. We don't have to just follow along in what everyone else is doing. And, you look at Rhode Island's history, there's actually moments when this has happened. In the 1940s, Rhode Island was a model when they tried to use Social Security money to pay for poor people's health care. The federal government wouldn't let them do that. But 20 years later, when Medicaid was written into law, the actual federal legislators who wrote it into law, they used Rhode Island as their example. They said, Rhode Island, this is exactly what we want to do on a national basis. Now Medicaid covers tens of millions of people. Now let's take that next step. Let's be the force that drives this next level of change, right? And there could not be a moment where we need this more. I mean, I have patients in my emergency department who are coming in late with heart attacks. They're coming in late with strokes. They're coming in late with appendicitis because they were afraid to come into the hospital. Some of them were afraid because of the coronavirus. Some of them were afraid because they got laid off. They lost their health insurance that was covered through their job, and now they don't have a way to pay for their care. So I'm forced to make the same thing again, just trying to convince patients to come in, even though I know that they're going to be saddled with debts that they can't pay. And I just, I really am looking forward to having someone in the Senate, someone like Janine, actually Janine herself, who's going to be fighting for Medicare for all. When she was a state senator, she introduced a bold Medicare for all plan in 2018, before it was like the coolest thing on earth, before everyone decided that, before the national polls made it, the force that it is today. She was introducing this bill. And I think that having her back in the Senate, being that leader we need, is going to make all the difference. So, this is a small district. We can win this if we just have people out there not knocking on doors anymore, but making phone calls, donating, getting their voice out on social media, doing everything they can to talking to all their friends, making sure that they know who Janine is, what she stands for, and why we need her right now. So thanks so much for running this campaign, and I'm really looking forward to seeing you back in the Senate.
Thank you so much, Luke. I can't express to you how honored I am to have your support. You have been out there doing the work as well, like not only being an awesome, doctor, but also spreading this message about why single payer healthcare is so important, why people deserve to have healthcare as a right. No one should be denied treatment because they can't afford it. People should not have to go bankrupt because they have to pay their medical bills. It's amazing that your hospital no longer sues patients. That to me is amazing. And I was shocked when I first learned that happened, but it's so important, and there's so much still to be done. And we can do this in Rhode Island. When it was implemented, when single payer was implemented in Canada, it was implemented in Saskatchewan, which has a population of about 1 million people. Well, so does Rhode Island. We can do it here. The thing that stops us is political will. We have an insurance industry that makes a lot of money off of healthcare, and all they do is find ways to deny people. Sorry about that. They find ways to deny people treatment, and that's not the way it should be. It should be anyone should be able to go to any hospital they want, and then have a Medicare system or something like that just take care of paying it. Luke, I don't know if you have any exposure to this, but one final thing is like, in a prior life, I did work for a couple of hospitals, and there's a large staff that has to deal with all of this billing, right? Submitting approvals, getting billing, payments in. If they deny it, then do you try to fight it, or do you have to send it to a patient? And one of the reasons I ran in the first place was because it's awful to send a patient a bill for tens of thousands of dollars when you know that they're sick and they're not working and they can't pay for it. So I don't know if you had anything to add to like that kind of thing, and if not, that's okay too. But
no, absolutely. I mean, I did not go into medicine to bankrupt my patients. I didn't go into medicine to stress my patients. I came to do my best to heal them when they're sick and comfort them when I can't. And I can't think of something that demoralizes doctors and patients more than the idea that we have this system that is ruining patients' lives. And it's not just here in Rhode Island, but we have a chance here in Rhode Island to forge something better. There's a good book out there called Health Justice Now about how, what this might look like. And instead of having this huge flood of administrative staff doing their best to like fight with insurance companies and insurance companies fighting to deny claims, why don't we just redeploy these people who have like extreme amounts of expertise in social services and social protection to actually, instead of denying those claims, like helping people to get what they need, helping people to connect to the services they need outside of medicine. You know, we know about the social determinants of medicine. We know about housing. We know about food. We need an army of people helping get people the things they need instead of working to deny them. We could deploy that tomorrow. So, you know, I'm really excited to work with you to make that happen.
Great. Thank you so much. I really appreciate it. Thank you for being here and for, you know, helping to raise the awareness about this, and obviously for all the work that you do to continue this fight. Thank you.
Thank you.